Nigeria's federal government has received about $9.3 million from the Canadian government to support and scale up its COVID-19 vaccination drive among priority groups. Launching the Canada Global Initiative for Vaccine Equity, also known as CanGIVE grant in Nigeria, the executive director of the National Primary Healthcare Development Agency says the fund will be implemented in states with low vaccination program. Our correspondent, Idong, compiled this report.
The Canada Global Initiative for Vaccine Equity, also known as CanGIVE, is a 2-year, $9.3 million grant for Nigeria from the Canadian government. This is aimed at supporting Nigeria's COVID-19 vaccination drive, especially aimed at priority groups, and also expected to strengthen the nation's healthcare system by integrating COVID-19 vaccination in healthcare services. With data from Nigeria's National Primary Healthcare Development Agency revealing that Nigeria has reached over 75% of its target population for persons above 18 years, and many who have received at least one dose of the COVID-19 vaccine. This has, however, been recorded in only a few states of the Federation.
We know that ultimately it takes a health system to turn a vaccine into a vaccination. That is why in 2022, Canada launched CanGIVE. Under CanGIVE, the WHO project will be implemented in 7 countries, with Nigeria receiving the greatest share of 9 million Canadian dollars.
Several states have primary series coverage below 70%, and booster doses account for just over 20% of vaccinations. Therefore, this grant targets states with lower performance. The states that have been targeted for implementation include Ondo, Rivers, Kogi, Delta, Ebonyi, Lagos, Akwa Ibom, Bayelsa, Benue, Ogun, Katsina, Taraba, Anambra, Kebbi, and Edo states.
The executive director of the National Primary Healthcare Development Agency, while commending the Canadian government for their goodwill gesture, assured of the federal government's commitment to sustain and improve ongoing COVID-19 vaccination drive and the nation's routine immunization performance.
I want to assure the Canadian government and our donors and partners that the federal government of Nigeria is fully committed to sustaining and improving COVID-19 and routine immunization performance, along with other primary healthcare services.
WHO, together with other partners, including Canadian government, will continue to collaborate with partners to support the government effort to ensure that the vulnerable population are protected and the structures and health system are strengthened. We shall continue to provide technical support to implement One Health approach.
Though COVID-19 is no longer a healthcare emergency, stakeholders have cautioned citizens on the need to continue to protect themselves against the pandemic.